Dr. Erin Kumpf is a nationally board certified and state licensed acupuncturist and herbalist in the states of New Jersey and New York. Erin specializes in women's menstruation disorders, hormonal imbalance, and fertility. She's also a certified Holden Qigong teacher. Erin graduated from Pacific College of Oriental Medicine in 2013 with a master's in acupuncture, Chinese medicine, and then a doctorate in acupuncturist and Chinese medicine in 2015. She's continued on to study endocrinology and reproductive health and is also a fellow of the American Board of Oriental Reproductive Medicine. Erin grew up with a fascination for the human body, the mind-body connection, and the connection between our environment and our health. After suffering from amenorrhea and irregular menstrual cycles that resulted in significant pain and erratic bleeding for over 10 years, Erin was reluctant to proceed with the aggressive treatment plans being recommended to her. After embarking on a holistic endeavor of weekly acupuncture treatments, herbs, and diet adjustments, she quickly experienced firsthand the beauty, elegance, and power of this medicine. Her own experience was so profound and results so impressive that she felt compelled to follow her heart and achieve a doctorate in Chinese medicine in order to help as many women as she can who are also frustrated with stubborn health issues. She has since specialized in treating the root causes of menstrual irregularities, hormonal imbalances, and fertility issues. Her mission: to bring relief and hope back to as many people as possible that have been told there is no hope. Erin believes in and respects that we all have a healing intelligence that is powerful, but many people have lost touch with this power. She works with each patient to help them reconnect to their own healing wisdom and to help people live their best lives. Hi, Erin. Welcome to the show. I'm very excited to have you on today.
Thank you. I'm delighted to be here as well. Thank you for the invitation.
Yeah. So, you and I have known each other for years. You're a Chinese medicine practitioner and acupuncturist locally in the Hudson County area in Jersey City. And we co-treat a lot of patients that are having fertility, pregnancy, postpartum women, right, that are going through that phase of their life. And when you and I were talking about today's episode and what we want to cover, because I've worked with so many Chinese medicine practitioners on this podcast and talking about how it helps with fertility, how it helps to balance women's hormones, how it helps with menstrual cycles and, things like that. But I don't think I put a lot of emphasis on how powerful it is for a woman recovering after birth, those first 3 months in the fourth trimester, and what that looks like. So I was excited to cover that topic today. So I'd love for you to just kind of start off with sharing kind of how you got into Chinese medicine and acupuncture.
Sure. Yes. So, gosh, it was probably about 20 years ago now, but I was a person who suffered from irregular periods forever. I mean, since I was, probably 15 years old. I mean, I'm probably not unique here. I was a very active teenager. I was a runner, very much concerned with, how I looked and everything. And I was very, probably not eating and taking in nutrients that was that allowed me to be in a healthy, sustained state while also being so active. And I would go through periods, no pun intended, where I wouldn't get my period for a few months. And as a kid, yay, you don't get your period, woohoo, you don't have to worry about. But, as I got older and a little bit wiser, I recognized that probably was not really a good thing. So I went through the conventional route of trying to determine what was going on hormonally that would be accounting for this, and had all the normal diagnostic workups and everything. And the only real solution that was provided to me was hormones. And of course, I was trying not to do.
That's a universal response. Your period's irregular, take the pill. Your period's heavy, take the pill. Your period is anything outside of the norm. And it's not from a contraceptive perspective. It's from take these synthetic hormones to quote unquote balance your body, balance your hormones, right? Exactly. And you and I know it's the furthest from the truth.
further. If anything, it will just exacerbate a pre-existing thing, underlying deficiency that's already, or imbalance is already there. And PCOS is one of those things. But I don't want to get ahead of myself. So yeah, so that, and I was really frustrated with that.
Did you take the pill?
I think I did.
I mean, I did as a teenager. I had heavy periods, and
for a short period of time.
You know what I mean? I didn't know better.
Of course. I mean, as a teen, you look to guidance of the caretakers, not necessarily our family, but I mean, like in terms of the medical community, to tell us that what's in the best interest of us. And so it's like, of course, like that's what they're like, okay, that's what you're recommending. And I did try it for a short time, and I did not feel well on it at all. So I wasn't on it for an extensive period of time. And so I was seen by an endocrinologist, and the same thing. And in hindsight, what made me angry was like, looking at lab work, of course, is going to tell you a lot of information, a lot of important information, but it's not the entire picture. And what I found was lacking in hindsight was a real deep dive into what is going on. What are you doing in your life? What are you eating? How much are you moving? Let's look at you constitutionally and being like, okay, something else is going on here that maybe we need to look at, aside from just throwing on some hormones on there. And so before kind of going into the hormone route again, I came across an acupuncturist. I was at the time going to yoga in Hoboken at a studio that was near the path, and there was an acupuncturist next door. And I just kind of like glanced at her webpage, and I saw that she treated like hormonal imbalance. And I was like, my mom went to an acupuncturist in the 70s for like migraines and had some success. Let me see what's going on here. And so I ended up going to her. She did a full assessment, which I really appreciated, a really deep assessment of what was going on. And I ended up going through the series of probably weekly visits for about 3 months. And my period not only came back, sorry, let me go back for 1 second. I didn't get my period for a whole year. And that's what was like,
I was like, menopause.
Yeah. And I was like 23, 24. So it was like something, I was really, really nervous about that. So within 3 months, my period came back, and it was like clockwork ever since. So I was like, okay, so of course, like many of us, the impetus of us going into a certain field, we have our own personal experience. And that was the lightning bolt. I'd always thought I wanted to go into the medical field.
Is this Ariel you're talking about?
No, it was Aradhana. Aradhana Bale.
Oh, Aradhana. Yes, I've known Aradhana for a long time too. Wow. So that was your first experience and introduction.
Yeah, my first experience. I did the acupuncture, herbs, the whole gamut, and some lifestyle changes also. A little bit more kindness
that's a big
to my
part
body.
of it, right? And I think sometimes people they come to you or they come to me and they're receiving these passive treatments. But I think what's different about how you and I practice is we also teach and educate and empower the women in front of us of like, let's talk about your lifestyle and how can you make changes and improvements? Because I always tell people, the time you spend with me is a few minutes compared to the rest of your life, right? And I'm not going home and cooking your meals. I'm not going home making sure you're having positive thoughts and making sure you're moving your body, but I can tell you what can help. And then it's up to you whether you take action and do those action-oriented items, right?
Absolutely. Absolutely. Which is why part of the treatment plan for our patients maps out, of course, like coming in for acupuncture, if there's herbs or supplements that we recommend, but also like, what are the things that we're recommending that you do outside of the clinic? Because what we recommend that you do and that you implement is honestly even more important than what we do inside the clinic. So
it 100%. Is more important because that's the majority of that person's time, right? And I think what I also like about it is people are like, oh, I kind of know how to be healthy, and they may or may not be following what they consider healthy. But when you work with a practitioner, they're going to customize it. So like, let's even talk about diet, right? You're going to be able to give specific dietary recommendations to that woman. That's different than, just a quote unquote healthy diet.
Yeah. Yeah. The whole like one size fits all. That's the antithesis of Chinese medicine, actually. It's like, constitutionally who you are, like what do you present, what's your skin like, what is your digestion like, how you're sleeping, that all plays a part into also what sorts of foods would be really beneficial for you versus another person. Of course, like the overarching theme of all of these sort of Western-based diets is like no processed foods, as many fruits and vegetables as possible, some healthy animal protein for of course not if you're talking about veganism or vegetarianism, but like what are the commonalities in all of it? It's like the least amount of processed foods, the most amount of plant foods, lots of water, lots of rest. It's like that's not brain, you don't need to be brain surgeons.
That's foundational, right? And everyone will benefit from that.
Exactly.
And then you can go deeper with some customized intricacies. Even there's so many different herbs out there, right? So like taking the right herb at the right time is where the power is. And high quality herb, right? Like also like not all supplements are created equal. So something that is, recommended specifically by your practitioner. I know people love to Google stuff or order supplements on Amazon. I mean, they tell me, oh, I got my supplements at Costco. I'm like, oh my God. Okay. That may not be the best source of vitamins. You can get some maybe organic vegetables and fruits there. Great. But like when we're talking about a supplement, we really have to be aware that there's some powerfully helpful supplements out there. But I think supplements have get a bad rap because there's so many and they're not all good, right? Which is anything, right? There's good things and bad things. But people don't necessarily know how to differentiate. And that's what our jobs are, is as practitioners, is to know which ones are high quality and effective. And even a high quality supplement, if it's not the right one for your body at that moment, is going to stress the body, right? So we don't want people come in with a bag full of supplements. Oh, I'm taking 40 different supplements. I'm like, that's not healthy. That is overwhelming your system. So let's get very specific and let's give your body what it needs right now. Recognize that it's healing. So a few weeks from now, your body's needs will change. Your supplement regimen will change. And we evolve with it and we change with that, right? We don't just keep taking the same thing over and over again unless it's like a maintenance supplement. But like the volume is another issue, right?
Absolutely. Like I cannot agree with you more.
Yeah. Less is more. And then ideally the majority of it comes from your diet, right? And then recognizing that, there can be holes in our diet and or organs that are very stressed that need additional support, but, minimalist.
Yeah, absolutely. Yeah. Sometimes if someone comes in with 20 things, we can like pare that down or even to start from scratch and have them on like a very condensed list. And it's just providing the foundation so that the body's innate healing mechanisms can actually come back online or come to fruition. And like you said, more is not always better. It's just the right thing at the right time and then reassess.
Yes, always. And that's the other big thing. Somebody comes in with like a lot of symptoms and they're, have some chronic things going on. They might need a handful more. Like they might be in my office. I might put them on 5 to 7 different things using homeopathy, herbs, nutrients, like combination, right? But this is also not on forever. This is like short term. Let's get over the crisis. Let's get the inflammation down. Let's support your endocrine system, yada, yada. And then as your body heals, those supplements are no longer needed. And now new supplements are the right fit. Like we go through these stages of healing and the supplements are relevant at those certain stages. I'm realizing we're getting a little bit off track. We're just raving about how wonderful holistic medicine is. And then I'm like, well, let's talk about the fourth trimester.
Sorry, I know.
Yeah.
I also get very, I'm very impassioned.
You and I are both very passionate about this. And I think, we can never talk about it enough because it is still not yet mainstream. Although I think you and I can both agree more, at least in our area, more and more people are choosing, quote unquote, alternative medicine, things like, acupuncture, Chinese medicine, chiropractic, because they are, especially people with chronic stuff, right? People that are of chronic issues, they might have went to their primary care doctor first, but they're not getting the answers they're like, something's missing and I'm not getting I'm not getting better. This medication is not healing my body. I want something else. And they're looking for something else, which is why it's called alternative. I mean, I'd like to think of it more as complementary, because we're not here to obviously replace allopathic medicine, but, we can be very complementary. And sometimes there's definitely times we should be the first resort, right? So let's talk about women who just gave birth. I know you see so many women in your practice. So you see a lot of women from preconception all the way through postpartum, right? So let's talk about the same thing, some of the case studies maybe in your practice. So a woman's coming in, she's trying to get pregnant. Maybe you're working with her along with the fertility medicine doctor, right? They're doing maybe IUI or IVF, or not. And now they're pregnant, and you're supporting them during the pregnancy to help their body thrive and feel good. And I think with Chinese medicine, you're really looking at, like you mentioned, their constitution, any predispositions to imbalances that might be that could have happened, and helping to maybe mitigate that or even prevent it.
Yeah, absolutely. Right? So basically, which is why there's a whole life cycle. So if someone comes in for fertility treatments, they become pregnant. We see them through pretty regularly through the first trimester, just to make sure that they're cared for through that initial 12 weeks more closely, and then sort of more maintenance, and then the labor preparation, and then they have their babies. But in the treatment plan, we try to emphasize the fact that the treatment really doesn't end when they deliver. It really it extends past that, and explaining, especially for people that are coming in for fertility that are having some challenges. I don't want to go into a deep dive into Chinese medicine in terms of like all the language and the vernacular, because a lot of it, it's a longer conversation. But to sort of give an example, if someone has trouble conceiving, say they have irregular cycles, they have really scanty cycles, scanty periods. We call that there's a level of blood or yin deficiency where there's just not enough substance. The nutritive fluids of the body are a little bit lacking, and they have support. They have acupuncture, they have chiropractor, they have these supplements and herbs that help to kind of nourish what is lacking. So they end up getting pregnant. Fabulous. And they have a really healthy pregnancy. The predisposition, if it wasn't that blood deficiency, if it wasn't sort of addressed going into pregnancy, and even if it was, there's a possibility postpartum, you're building a baby for 9 months, right? A lot of resources are going into a developing fetus and baby. And then through the birthing process, regardless if it's vaginal or C-section, you're losing a lot of vital essence, like a lot of blood, a lot of energy, a lot of chi goes into the birthing process. So there's a relative level of deficiency, regardless if there was a traumatic labor. Obviously, it's going to be a deeper level, or if it was a quick labor. There's still a level of blood and energy loss there. And so one of the main things we see is we'll call it the baby blues, but it could be a lot more severe than that. Of course, if it's at a certain level, there's an additional level of support that needs to be there for the mom. But in terms of most women, there is a level of deficiency there, and the possibility for we'll say a level of depression or anxiety is it's not always going to be there, but there's a deeper level of possibility there, because there's just not enough substance for our consciousness and our spirit, which in Chinese medicine we say is stored in the blood. We have an abundance of blood. We feel grounded. Our emotions are more grounded. We feel like we're operating from a really solid groundedness. And if there's this level of loss, then emotions are much more erratic, and the feeling of unwellness can be heightened. And you're also still trying to care for this newborn and do everything else, and manage the household and all of that.
Which is why I always talk about delegating that stuff.
Yeah,
every 4 trimester podcast, all you have to do is focus on healing your body and feeding your baby. And the laundry, the dishes, the cooking, cleaning, that goes to someone else, man. That's
Yeah.
not new mama work.
Yeah. Like
No way.
exactly the whole premise of, in many cultures, as we know, they do like the sitting month, the doing the month, like the 30 days postpartum,
Or
where
40.
like
Yeah.
mom really, like in some cultures, they really are only supposed to be in bed. The baby is with mom to nurse, and everything else is handled by everyone else. And it's really a way of focusing on recovery at a deep, deep, deep level, that rebuilding the blood and energy reserves and allowing her to bond with her baby and concentrate on being a new mom and not having to do everything else. And that gives the body such an ability to rest and recover. And
yes. And I think just as you just said that, I always thought about that physical recovery from the pregnancy and birth. And obviously we know that you just ran a marathon or whatever. You got to rest. You got to take it easy. And this is at even a deeper level, right? So like laying in bed makes a lot of sense, right? But there's more than just a physical recovery that's going on. There's a transition to, if it's a first time mom, of your identity. And I mean, there's a massive energetic, emotional transition that occurs after that birth for women, all women. And now let's say it's a second or third time mom, there's still that transitioning still happening because now you're a mom of multiple children, and it's just adjusting to this new identity or this new role as a woman, right? And our culture definitely doesn't give enough credit to that as well. And I think that's why, women go back to work. Even myself, I went back to work way too soon after my birth. And I didn't really give myself not only that time to bond and connect with my son at the level I wanted, but there was this, well, I am a business owner and I'm a chiropractor, and let me put that hat back on. And I was still like trying to learn what it was to be a mother, right? Like I was still not really, let's say, stable in that role or that identity. And I was just like, oh, let me go back to my old role because that's what's comfortable and familiar, right? So it's hard. It's really hard for women to do that. And I mean, men go through that too, but not probably to the same intensity is my guess. Did you know that there's an organizing app designed just for families? If you're starting to feel busy again, and I know I am, and your calendar is jam-packed with events and kids' activities, why not do yourself a favor and get Cozy? Cozy is the #1 organizing app that families use to juggle school schedules, practices, meetings, doctor's appointments, and even a workout or date night. With Cozy, you'll be all set up to know everyone's schedule, who's doing what, when, and where. And Cozy will even send emails every morning with the day's agenda. No more missed pickups or double bookings. Here's how it works. Cozy tracks everyone's schedules and events in one place with a shared, color-coded calendar. Cozy even reminds others about events so you don't have to. It's easy to get started. You can pull in events from your family's personal work and school calendars, and the best part, it's free. Just download Cozy Family Organizer from the App Store. That's COZI to get the free app today. I know I've been using it, and I absolutely love it.
They haven't had also that level of, again, building the baby, growing the baby, and birthing the baby. Like that is such, in terms of not just chi and blood. When I say chi, like what animates us, this like life force, but also this concept of Jing, which in Chinese medicine is rooted in the kidneys, but it's loosely correlated with DNA. But it's like what exactly when the gametes combined, and the egg and the sperm combined, it's the essence of those cells that are injected into this brand new life. And a lot of it has to do with the health of the mom and the dad, like what's going on with them at that time also. But we have this almost energetic bank account, and our lifestyles and what we're eating and drinking and our emotions will help not necessarily put money back in the bank, because it's almost like it's like a vault of little by little as we grow and get older, like a little bit's drawn a little bit at a time. We can kind of supplement and make sure we're not drawing on it too much by eating well and exercising and feeling, whatever, if it's spirituality, whatever helps you feel connected, like making sure that is all part of like your lifestyle will help make sure that you're not drawing on too much of these reserves. But growing a baby, building a baby, and birthing a baby draws a lot on that essence. So it's like even more important that their time is given to rebuilding the resources of chi and blood, because especially aside from physically, the emotional transition, like you're saying, into this new life and this new role requires a lot of resources, and we're operating at a deficiency. So it's like, how can we nourish with the right foods and rest and having and creating that space to allow for what needs to happen between you and your baby, and emotionally and physically, so that you can be the best in your best state going forward.
Totally. And so let's talk about what that looks like for a new mom. We talked a little bit about the lifestyle component, right? Making sure also that you're getting support with the home stuff. And the other thing beyond the home, the other thing that really came up for me as a new mom was having healthy home cooked meals. I really wasn't in the feeling like I wanted to do that for myself, even though I felt like my body really needed that for recovering and for making breast milk. So I had a postpartum doula, and she would help with some cooking, and my husband helped with some cooking, but I probably even needed like a meal delivery system. I remember we had like one of those box ones, and I'm like, I don't even want to make this. Like, I don't want to put it together. I want it ready in the fridge. So they do talk about that, having things like meals already prepared in the freezer or fridge that you just warm and eat, and it's quick and it's healthy. And because our bodies really need to fuel a lot of fuel after giving birth, right? Not only for breast milk production, but for healing. So let's talk about maybe what some of these healthy meals can look like for a new mom.
Yeah. So, I mean, in terms of, I'm going to talk about it in the context of Chinese medicine, like things that help tonify blood, help tonify qi. Those are the kinds of things that would be really good to eat. Things that do not take a whole lot of resources to digest. So, I mean, in general, a good premise for eating is like making sure that you're not eating things that are too cold or too warm. So it's contrary to a lot of more mainstream ways of eating, like raw food diets, which everything can in some shape or form can have a benefit. But in terms of Chinese medicine, the whole premise is, how do we keep this digestive fire at a slow burn so that we're not using too much energy in the digestive process, so that energy can be diverted to these other systems of recovery and building blood. So things like congee or khichdi, where you have this rice-based porridge with a significantly more amount of water in it, so that and the rice is cooked longer, with some herbs and some spices that are, and particularly like cinnamon, cardamom, things that are warming, ginger. You can add even a little egg, turmeric. You can even add like a little bit of, if you are not a vegetarian or vegan, eating a good quality, high quality chicken would be fantastic, because it's not going to take a whole lot of energy for you to digest it. It's very easy on the stomach. And rice in Chinese medicine actually tonifies the spleen, which is more than just the spleen in Western medicine. It's really like the pancreas, the process of being able to break down foods.
Is this white rice, brown rice? Is there like any
white rice in Chinese medicine? White rice is actually easier to digest, which makes sense. I mean, like, if you think about it,
it is part of, I mean, it doesn't have as much nutrients, but you're saying it's just easier to digest than like a brown rice.
Exactly.
It's more whole form, right?
Exactly. So in terms of nutrients, yes, exactly. So I would say add in things that tonify qi, along with the rice would be like mushrooms and yams and clove, fennel, things that build blood, beets. Like, I'm a big proponent of cooked beets and obviously dark leafy greens. You can also add those into a good soup with bone broth. Like
Right.
that
So
is
this is
like
the warm food, not eating it raw.
exactly. So I think the main premise postpartum is to not allow pathogenic cold to enter. And when I say that, it's a very Chinese medicine way of speaking, meaning not exposing ourselves to things that will slow things down and inhibit further healing. So especially with a C-section, when you're in this cold operating room, we can say that cold in the process of the procedure, just like cold exposure to this outside world that would not normally happen outside of surgery, can get lodged in and the healing process. We say like blood stagnation can happen, meaning we heal, we can heal well, but there might be some, whether it's adhesions and scar tissue, like blood just not moving as optimally. And this nature of cold where it's contracting. And that's why a lot of women have like painful periods after, or a lot of like pain in the lower abdomen. If there's an element of cold that was able to kind of lodge in there, or eating foods that are too cold, going outside with damp hair. Those are the types of things that can predispose us to having this nature of cold internally that inhibits this healing process. So eating warm foods, yes. Moxibustion is one of the main things that we use postpartum, because it is an herb, mugwort primarily, that you burn over the acupuncture point, that helps stimulate the acupuncture points with heat rather than mechanical pressure or a needle. And that is especially up the center channel from the top of the pubic bone up to the umbilicus, that whole area, really generating some warmth to help facilitate that healing.
That makes a lot of sense.
I didn't want to segue into out of the diet, because we can come back to that, but I just want to kind of emphasize.
If you're done with the diet stuff, let's talk about that. Like some of the moxibustion, and you would use that in an acupuncture treatment, or can people do that? I know with breech babies, they do it at home on themselves. Do you recommend that in fourth trimester?
Yes, absolutely. I would not. It's not good practice, obviously, to add heat over a fresh C-section scar, like especially if it's not healed.
You probably got to wait at least 4 weeks, I'm assuming, post-surgical for that. But let's assume it's a vaginal delivery. They can do it soon after the birth?
Yeah. So I'd say in the first couple of days, it's really, the body's still, kind of purging the rest of the remnants of the birth, the milk starting to come down. There's a lot of like letdown and purging that's happening. But after about day 3 or 4, yes, moxa on the lower abdomen. So it's like part of daily for like a week. It's like 10 to 15 minutes on the abdomen is really beneficial. So we will give our patients, also if they're coming in for breech presentation, give them a stick of moxa with explicit instructions on what to do and where to do it. And that can be exceptionally helpful. And they feel, and for most people that have had moxibustion, especially on the abdomen, I don't know what the nature is about mugwort, but people that have never been exposed to moxa, it's smoky, and you wouldn't really think like it's a comforting smell, but there's something resonant about it. Mugwort internally is used in some formulas to help warm the uterus. So there is this element that I think that we connect with that is really nourishing and warming. So even just the act of not only warming it physically, but the aromatics about it is very comforting, and people love it.
Yeah. I mean, I've had amoxibustion, not on my abdomen though, but it is, it is an acquired smell, I guess, and it smells like pot a little bit.
Yeah.
It is
people are like, what are you doing back there?
And there is the physical heat, but to your point, it's more than the physical heat of the burn. There is something that's just very warm. It's a warming herb, like you mentioned. So to me, it makes sense that even taken internally, it's used for warming the internal organs.
Yeah. So moxibustion is can be profoundly helpful, especially which is why we also, as part of the action plan, and we try to emphasize this again in the treatment plan, when you give birth, as soon as you feel and as soon as you feel that you have the resources to, like, not that we want you to go out and be doing all these things, but in terms of like obtaining some support, come back in and we can administer an acupuncture session and then provide them moxibustion. And honestly, like you said, especially first time moms, what I see is they come in and they look shell shocked.
Yeah.
They
do.
Shell shocked. And they're just like at their wit's end because they're overtired, they're not sleeping, and they have this huge transition that they're in the middle of. So having that support, I find, and they find, it is, I can't even put like words to it. They really do. I see them thrive when they have that support, which is not shocking, right?
And it's that self-care. And I recommend the same thing, especially if it's a vaginal delivery. I mean, if they're C-section, I can't really do an adjustment typically till about 4 weeks because we have to let the incision heals to go face down, right? But if it's not, I can see a woman within, as soon as she's up for coming into the office after the birth. And what I find is not only is it giving them that support, but it's accelerating the healing process, right? I think that's the other thing that's going on here. So you can certainly stay home and do nothing except rest, or you can do that and then, without overscheduling yourself and going, you don't need to be having like daily appointments here, right? Like running to all these different offices, because that's going to overwhelm your system too. But having 1 or 2 appointments a week, maybe with your chiro, with your acupuncturist, and getting that support and that just that time for yourself. Like someone else was watching the baby. I mean, there's that vigilance, right? With new moms too, that like, oh my God, I have to like watch my baby every second. And that's exhausting and draining too. So it's like, okay, someone else has got the baby. It's like meditative, right? I can just relax on this table for a few minutes and I don't have to do anything. I don't have to take care of anybody except myself right now.
I just thought of and I can say this because there's no HIPAA violation here. It's just a phrase I heard someone say one time. It was probably like a week or two. It was probably 2 weeks after she gave birth, and I remember she was on the table, and I think she had tears in her eyes, and she absolutely loves her baby. So obviously, but she was so happy, and she was like, "This is the first time in 2 weeks no one's needed anything from me." And I think it's important for women to understand it's okay to feel overwhelmed and feel that they're deserving of having some time where they can just focus on themselves for a half an hour. This is not like,
you're not going to the spa for a whole day at this stage in your life. That time will come, but we all, all women need this break. Especially these first few weeks, up to 3 months, really, of this postpartum period, to just like say, okay, this is all about me right now. And it's not being selfish. I go over this over and over again. This is not being selfish. When you give so much to everyone around you, I mean, you literally made this baby. Now you're feeding this baby, you birthed it, I mean, it is so much work to go into that everybody needs a break. We're all human, right? So there's no shame with that. And I just would love to see it become more of the norm, right? That this is happening and that this woman is even feeling supported enough where she's like, okay, my husband can watch the baby, for this half hour while I take care of myself, or my mother-in-law or somebody, that it's like, this is okay. I mean, in my office, we have the women bring the babies in with them because we ideally are adjusting the baby as well. So we have these dyad appointments scheduled and mom and baby go back to back. But once again, let's say the mom's getting an adjustment and the baby's with her. And the baby wakes up, starts crying. My front desk is holding them or giving them a bottle or whatever we need to do, just so this self-care can still happen and not be interrupted, right?
I remember holding a baby and like singing to the baby while mom was on the table, and it was like this is what it's about, right? It's
This is
like
what
you
it's
just
about. Like, I mean, yeah, if you can, if, you know, if you don't, if the appointment's just for you and it's nice to not necessarily have to bring the baby, but, life happens, right? And sometimes, women don't have the support they need for, multiple reasons, but it's all about, it doesn't have to be like, well, then that means you don't get to get self-care, right? Like, I think any practitioner who's serving postpartum women is going to be, like, how can we help support you in that too? Yeah, if you have
yeah,
to hold the baby for 15 minutes, the half hour, like, that's fine. Get to cuddle, man. They're only that tiny for a small amount of time. It's like, I'll
totally.
hold your baby.
Yeah, and then it's when mom feels supported, she's given that rest. She's starting to rebuild those reserves of chi and blood. She's going to show up much more how she wants to show up because she has the resources. And it's almost like putting your oxygen mask on first. I know it's cliche. Of course, with a newborn, the newborn oxygen mask is probably going to go on first, but you need to also make sure that you have the resources and you're able to rebuild so that you can continue to operate from a position of feeling nourished yourself when you're helping to make this new life thrive, helping you thrive too.
Yeah, helping you thrive. So the women that are receiving this type of care not only are going to physically heal faster, I mean, that's just a given, they're emotionally going to be in a better place. I think what I would assume, they're less likelihood to have that more severe depression, anxiety, like you mentioned. A little drop in mood, I think, is typical with the hormonal changes, but it's something that you can kind of process without needing, let's say, medication or even potentially, therapy or things like that. Like a more severe postpartum depression or anxiety can happen, right? I think those, from what I'm seeing, like you're healing faster, and that also means your hormones are going to be balancing, I think, in a faster way as well, which we know is very much linked to these depressive type imbalances. And then the overwhelm and lack of support, I think, also can contribute to that. So if we can help support them, then they're going to ideally feel like not so like, oh my God, I don't know what I'm doing. And that sense of overwhelm, I think, will also trigger depression and anxiety, right? Even
Oh,
beyond
totally.
the hormonal stuff.
Yeah, and the nervous system, like the central nervous system, and just especially, I think, probably more so with first time moms, but not necessarily, because now if you have multiple children, then now you have many to also kind of care for at once. But the central nervous system, like if you are operating at that sympathetic level constantly, then that also triggers anxiety and depression. So it's like the more we can bring up the
Parasympathetic.
then that is a huge bonus also.
Yes, it totally is. All right. Well, we're going to be wrapping up. Is there any last thoughts you wanted to share with the audience?
I just want to emphasize the fact that how amazing our bodies are at producing life, and not to discount that in that process in and of itself. Like, what an amazing, every time someone comes in and we go through this cycle and they have their baby, I'm like, it is amazing.
It's a miracle.
It's a miracle. And so just remind yourselves of how amazing your body will be at this whole process, and to be kind to yourselves, not only through pregnancy, which a lot of us are, but also afterwards. And
probably we need it even more so, I think, after the birth. Yeah.
Even more. So kind of think ahead. Just think ahead if you're anticipating having a baby, another baby, or you just gave birth, of like allowing yourself that space and time, that it's not selfish, like you said. It really is. It's going to go right back out there into to you and around us, the more we can kind of take care of ourselves, the better everyone around us will be, like mainly our loved ones.
Yeah, totally. Awesome. Well, Erin, this was amazing, and I really appreciate you taking the time to come on the show today.
Thank you so much for having me. I had a great time, and it was lovely.
Well, this was such a fun episode to have with a fellow colleague and practitioner in the Hoboken, Jersey City, New Jersey area. We co-treat a lot of patients together, and I'm very grateful to Dr. Erin for taking time to come on the podcast. If you want to learn more about her and her practice, you can check out her website at ekahlife.com, ekahlife.com. And look forward to seeing everyone on the next podcast episode. If you're enjoying Well-Adjusted Mama, please take a moment to rate and review the podcast. And I'm always open to receiving any notes or suggestions for future guests that you'd love to see on the show.